山姆。
还没开始录，还没开始。
Have you ever been to the hospital as a patient? If the answer is yes, so do you know how the doctors or the nurses talk about you behind your back? Dear Toastmaster, today I'm gonna tell you how to become a well-behaved and a responsible patient. Sorry. And here is the outline. First, I'm gonna tell you what are the problems may arise in clinical situations of Taiwan. Then, a simple discussion about the qualities of a good patient. At last, I will make a conclusion to find solution to present situation. Okay, let's move on to the first part, where I will show some interesting facts, and these facts all truly happened in Taiwan's medical history. And first is, some patients regard hospitals as hotels. It means that they go to the hospitals very often. And they consider there they could find warmth and safety and protection. They could find regarding hospitals as hotels. These people go to hospitals. These patients go to hospitals, no matter how slight or how small their disease are. For example, like coughing or sneezing. Oh, sorry. Or even, hey, do you see that? My fingernail is broken. It is severe. So something like that. I think the reason why they go to there because they find safety and the protection there. Most of all, they believe they could have better treatment. However, this kind of behavior is tremendously wasting our medical resource. That should be noted. And second, some patients ignore the doctor's order, or even their prescription they made. Taking myself for example, I hate to eat medicine. For what? I just can't stand the chemical smells. Oh, just so disgusting. However, I know. So sometimes I will forget to take the medicines as required. So I know that's bad, really bad. Then there are two aspects of patients in Taiwan. One of the kind, they are shopaholics of medicine. This kind of patients, they buy a lot of patent medicine from pharmacy or underground TV program. What's that? If you buy this one and right now, and I give you another one for free. Yes, just something like that. And another of the kind, they believe the more medicine they take, the stronger the effect. Like what? It's like maybe there is a 1 month dosage of medicine, and they consume it all in merely 1 week. In this case, the medicine is not helpful, but even harmful. So, aforementioned concepts are all wrong, including mine. So please don't do this. And third, there are sometimes patients are quite annoying to the doctors or the nurses. They may be over-demanding, which means they ask too much for services. For instance, like, hey nurse, hey nurse, give me some orange juice right here and right now, and no sugar, please. Or, hey doc, I don't like you. Hey, boy, have I done anything? Not really, but I just want a beautiful and good-looking doctress to be my doctor, to take care of me, not you. Just something like that. And also, sometimes it is reported that nurses under sexual harassment of the patients. I know it sounds terrible, but it did happen. So remember, you just every time you interrupt a doctor or a nurse, it means that you are threatening other patients' life. Okay, so far we have been seeing many bad examples. So what exactly are the qualities of a good patient? First point is understanding. The ability to tell right from wrong, to learn more medical knowledge, to cherish our medical resource. And second, if you want to be a good patient, then you have to be patient and obedient. Just follow what your doctor says and don't be hasty. After all, it does take time to recover from any kind of disease. That should be careful. And third, you should show your respect and manner to others, no matter they are doctors or nurses or even other patients. You respect others, and so they will respect you. Right, in the end, I hope you guys could all become well-educated and self-disciplined patients, so that we could have a harmonious society with good relationship between medical professionals and the patients. I say that not as a doctor or a medical student, but as a patient myself, for I have seen many great nurses or the doctors trying their best to treat, to help, and to care their patients. All I'm trying to say has all been shown in this picture. Thanks for your attention. Back to TME.